Hello, everyone. Welcome back to USA Health Info. COVID-19 may be making another comeback. Health officials say infections are slowly climbing across several states: California, Texas, Florida, Oregon, Nevada, Utah, and Hawaii among them. Case levels are still low compared to past years, but experts believe this could be the start of the country's seasonal summer COVID wave. So here's what we're covering: what's actually driving this increase, who's most at risk, and whether you should get vaccinated this summer. Let's get into it. According to the CDC, COVID activity is increasing across parts of the western and southern US, and California is showing the clearest signs. The percentage of positive COVID tests there has been steadily climbing over the past month. And that wastewater data we mentioned? It's one of the most reliable early warning tools scientists have because it tends to show a spike before hospitalizations do. So the real question isn't is it spreading? It's how fast and where. This timing isn't random. COVID has settled into a seasonal rhythm over the past couple of years, a summer wave and a winter wave. One big reason: a lot of people simply haven't been infected recently, so immunity has faded. Dr. Peter Chin-Hong, an infectious disease specialist at UC San Francisco, puts it simply: the country may just be due for another rise in cases. Here's where it's actually showing up on the ground. Kaiser Permanente, Southern California, is reporting a gradual rise in outpatient COVID cases over the past 2 weeks. LA County saw a noticeable jump in test positivity right after the 4th of July. Orange County and Northern California are seeing similar upward trends. And in San Jose and Palo Alto, wastewater levels are now rated high. Translation: the virus is spreading more widely in these communities. Health officials say the next few weeks will decide whether this stays a minor uptick or turns into a real summer surge. Here's the part that should actually make you feel better. Hospitalizations remain very low. ER visits from COVID are still far below levels from previous summers. And COVID deaths right now are lower than they were during this same period the last 2 years. That means vaccines, prior immunity, and better treatment options are still doing their job for most people. But, and this matters, even a small national increase can still hit thousands of vulnerable people hard. That's the group we need to talk about next. This isn't an equal risk situation. Certain groups face real danger if infected: adults, 65 and older, pregnant individuals, people with weakened immune systems, infants and young children, and anyone with a chronic condition like diabetes, heart disease, obesity, asthma, or cancer. If you fall into one of these groups, or you love someone who does, this next part is the most important thing in this video. California health officials recommend that everyone 6 months and older stay current on COVID vaccination. If you're 65 or older or immunocompromised, you may need 2 doses, spaced 6 months apart. And here's the timing detail most people miss. Officials recommend getting the current 2025-26 vaccine now if you're eligible, rather than waiting for the updated full version. Why? Because waiting means going unprotected through exactly the window we're in right now. Don't sit on a positive test, especially if you're older or have an underlying condition. Contact your healthcare provider quickly. Antivirals like Paxlovid can reduce how severe and how long your illness is, but only if you start early. Early treatment is one of the biggest levers you have to avoid hospitalization. This isn't just a US story. The WHO says global COVID activity is generally low, but several regions are seeing real increases. Taiwan expects its wave to peak in mid-August, and hospitals there are already handling more patients from COVID and seasonal flu combined. Japan, South Korea, Hong Kong, and parts of China are also being watched closely. COVID today is nowhere near as deadly as it was in 2020 and 2021. Vaccines, treatments, and built-up immunity have changed that story dramatically. But it still causes thousands of deaths a year in the US, and long COVID, fatigue, breathing issues, memory problems that can last for months is still a real risk, even in mild cases.
For most healthy people, this summer increase is not a reason to panic. It is a reason to stop assuming COVID is over. Stay current on your vaccine if you're eligible. Watch for symptoms. And if you're close to someone in a high-risk group, protect them like it's still 2021, because for them, the stakes haven't changed. We're tracking this every week as the data comes in, including whether Taiwan's mid-August peak ends up matching what we're seeing here. Subscribe and turn on notifications so you catch that update the moment we publish it. This kind of summer wave can shift fast, and we don't want you finding out from a headline instead of from us. If you found this report helpful, please like the video, subscribe to USA Health Info, and turn on notifications so you never miss important public health updates. Thank you for watching, and stay safe.